Nice to have you, Carolyn, as well. So, Jake, we've got quite a group of people gathering. I did want to let everyone know that I typically am pretty strict about stopping at 1:30, and today, just because of the looser format, we'll actually, if we have good discussions going, we'll let it run a little bit longer. So, Jake, may I turn this over to you?
Absolutely. Thank you, everybody, for calling in. If you see me looking down, I'm not avoiding the camera. I just have lots of notes. So first of all, thank you, Jacqueline, for the introduction and for normally running these meetings. As she mentioned, I'm Jake Carpenter. I'm based here in Juneau, and I am the current chair of the Health TIE Advisory Board. As you know, Health TIE is a couple of years old now, believe it or not, and I know some of the people on this call have been working and attending Health TIE since the beginning. One of the things that we think makes Health TIE special is, the diversity of thought and the different perspectives that come to the table. People from all walks of life and all industries participate in Health TIE events. Because of that, we feel like it's important that occasionally we get to know people and where they're coming from and what they can, why they come to Health TIE. And we want to make sure that we're maintaining that diversity of thought so that we don't all end up, thinking the same way and thinking the same things. Because I think a lot of the magic of what we do is the fact that we approach problems from different angles. So with that, the format for today's meeting, we're going to do sort of the traditional round robin introduction. And when you introduce yourself, I am going to mix this up a little bit and borrow from Joe Morrison, actually. And so when you introduce yourself, say who you are and why you're here. And then what do you need from Health TIE, or why do you come? What are you seeking when you connect to these calls? And then what can you offer, or what do you have to offer for the Health TIE community as a whole? And that can just be your presence. That's enough. We're not looking, to sign people up for work or anything. We just want to see, what our relationship is with each of the participants. After we do that introduction, I have a couple, sort of feeder questions that hopefully will get the discussion rolling. So just to iterate, this is really just a general discussion. We're not, we're not here for any particular project or any to make any big decisions. We're here just to ensure that we are listening to our constituency and in maintaining our diversity of thought. That being said, I'll start. I'm Jake Carpenter. I'm in Juneau, and I come to Health TIE because I was introduced to Health TIE several years ago. I have a disabled brother who has received services in Alaska most of his life, and so I've seen the healthcare industry from a lot of different angles, and I think that there's a lot that we can do to improve in Alaska. What do I need, or what can I offer to Health TIE? Well, I come here for inspiration and to see what's out there and to see what people are working on. By day, I'm an entrepreneur, and I work with other entrepreneurs and to build products or talk about products or design products. And that's also dovetails into what can I offer. I am a software developer. If you have any software questions, I've been a technical manager and a project manager for about 20 years too. So I can answer any questions people have about technical stuff. That's what I have to offer. And now I forgot to mention, if I call on you and you don't want to participate, that's okay. You don't have to. But I'm gonna hand off to Andrea.
Hello, everybody. I'm Andrea Andraschko, and I've been, I think, at almost every single one of these Health TIE meetings from the very beginning. And I've worked in the healthcare industry here in Alaska since 2005, I think it is. And so I've seen a lot of different issues that we deal with here in Alaska, with our distances that we deal with the the fact that we have to travel outside for a lot of specialty services and that sort of thing. So I've really been basically a student of the healthcare system here in Alaska for quite a while. And I am now, as of July 1st, officially full-time at Alaska Pacific University in the business program, but I'm also the sort of officially unofficial face of the healthcare management undergraduate minor. And so I am hoping to spend the next year building that program within APU and also extending our reach from the university out into the community and all of the different, not just direct healthcare providers, but those who provide services to healthcare providers. So pretty much I'm looking at the whole sphere. And so I'm here to identify potential, figure out who I can help bring into the Alaska healthcare system. So Arcadio and I have spoken, and I haven't forgotten about you. But I'm very excited about sharing Health TIE, and I'm so glad that you've got the videos archived now on YouTube as well, because my students will be looking at videos and learning more about Health TIE and the technology and where this is going to take us. So this is just a perfect segue for me to really bring in more people. So that's what I can bring, and that's what I'm here to give.
Thank you very much, Andrea. Next, I'm going to call on Alice Brouhard.
Hi, I'm actually coming in from Colorado. I got connected with Kim and Jacqueline through some other technology things that I do. I have a daughter who sustained a traumatic brain injury many moons ago, and through the use of technology, she is living independently. And I've done a lot of speaking throughout the country. I've done an international presentation via Zoom, but I can still say internationally, about how we use mainstream technology to support a young woman who has no concept of time, who's paralyzed on one side, who has severe vision impairment. But because of technology and 2 mainstream apps, she lives very independently with support during the day in her own home about 6 blocks from us. My interest in technology also stems from the fact that I'm a registered nurse, although I'm no longer working. I worked many years at our local hospital, which, by the way, is in rural Colorado. And through the years, as I got involved with my daughter with technology, I would hear family members say, Mom and Dad could live at home alone if only, if only. And having seen what technology could do to support my daughter, I really gained a keen interest as well in what technology can do to those of us who, and I can now say, who want to age in place. So I have a huge interest in technologies, and specifically mainstream technology to support people to live independently. My daughter lives with an iPad and 2 apps. One of her apps costs $1.99. It gives her own voice all day long. She tells herself what to do. And the other app that she lives by costs less than $20. So I really am kind of a champion in saying, let's look at technology as a very viable support for people with differing abilities and those who want to age in place to be more, to continue their independence. So I'm happy to be part of the conversations here too. Again, with my background as an RN, I'm always trying to think outside the box, and because I'm still called on periodically to work with some of the older folks in our community as well to support their independence. So I'm happy to be here. Thank you.
Thank you, Alice. And for those of you that are interested in hearing more about what Alice does, she is going to be presenting to the Health TIE call next month, I believe, on the 13th. So join in if you want to learn more. Next, I'm going to call on Sandra Heffern.
Hi, thanks. I'm Sandra Heffern. with effective health design. And the project that I'm working on primarily right now is the Alaska Healthcare Transformation Project. I've actually done a presentation at one of the Health TIE meetings. It's been a while, so I don't remember exactly when I did that. One of the things that we're looking at with that project is an all-payer claims database that looks at both claims data as well as quality data for the state of Alaska, so that we can really start getting a handle on how much we're really paying for healthcare, what the utilization patterns are, the different procedures that are being used, whether they're high value, low value, et cetera. I believe that there's 26 states now that have been using an all-payer claims database to really analyze what their healthcare system is paying for, and where they might be able to see whether it's efficiencies or cost savings, or even looking at gaps in service. So my interest in Health TIE is really looking at, is there a way that we can do this easily? You know, it's, I know that, you know, it's, people say if you've seen one healthcare system, you've seen one healthcare system. But I think that there's some consistencies or some threads that, regardless of what state it is, that there's things that can overlap and we can learn from other states. I'm intrigued that it's like, it seems that at some point someone will create a healthcare interoperable type system that we can all use, you know, and I mean, it's not going to be me, certainly, because it's like technology and I do not mix. So I'm looking for the people on this call to be the brains behind that. I think the thing that I offer to Health TIE is I've been working in health and human services in Alaska since I got out of college. I have a lot of connections here. I work on a collaborative model in really trying to bring people with different perspectives together. If any one of us could have solved our healthcare issues, we would have done it. But collectively, I really feel that we can, as long as we're looking at and really taking into account all of the different perspectives that it will take to solve our healthcare system. So thank you.
Thank you, Sandra. I appreciate your additions. Next on my list, we have Dr. Carolyn Brown. And after that, we'll move right into Solomon and Arcadio, just so that I don't have to interrupt every time. Carolyn, it looks like you're muted.
Gotcha. I'm Carolyn Brown. I'm a retired physician, and I've spent all my years in medicine in Alaska, with the exception of some residencies, since 1965. So I've been pretty much all over the map in terms of rural, the chain, public health, free clinics, private practice, academic medicine, and all of it. I'm retired now, so I have become extremely interested over the years in how my first residency was public health and preventive medicine. My second residency was obstetrics and gynecology, which is, sorry, I'll get rid of that. My second residency was obstetrics and gynecology, which, as you know, is very personal and deals less with the great unwashed out yonder. Over the years, I've become extremely interested in how medical care integrates with public health care, how that integrates with economic needs and assessments and access, how that deals with the social needs of people, and evermore the ethics of living life wherever we are. So I'm very, very, very interested in how we integrate stuff. I came to know Kim Champney several years ago as we worked on the fetal alcohol syndrome program, which I did for about 2 years. And so she introduced me to the group, and I thought, well, I'll just sit in and listen, because I'm very interested in how do you tie what I heard about the group is that it's entrepreneurial. You like to make things in a technological way so it makes things easier. And I thought, well, that sounds like something I could be interested in, because it seems to put together all the stuff I'm interested in with the widgets, gadgets, and gadgets to do it. And how do we do that best and make it a win-win for everybody. So I started just listening in, and when somebody presents something on something I know absolutely nothing about, I have a bunch of questions which usually relate either to private medical care, personal care, public health care, the great unwashed, legislation, or whatever, because of my other interest. And that's why I attend these meetings. So that's why I'm here.
Thank you.
Hi, my name is Solomon Himelbloom. I'm currently in Kodiak, but I'm a second-year computer science student at the University of Alaska Fairbanks. This summer at UAF, I'm working with an internship in the Students to Startups program, and I got interested in health tie and the Alaska healthcare industry after participating in a COVID-19 startup weekend a couple of months ago. I can bring technology, computer science knowledge to health tie, but I'm also interested in learning more about how the Alaska health industry is ever changing. So thank you.
Hi, my name is Arcadio Maldonado. I'll spare the details how I got here through kind of a long-winded way of getting here, but eventually I met Jacqueline Summers through contact, and who had invited me and our CEO to present during one of the earlier Health Tie events. So thank you very much. I don't share a personal story like all of you. I'm very thankful to have healthy and well, but one thing I like to position myself as is a conscientious business development rep. So I was looking for a company who was mission driven, and someone who I knew and had leaders that I believe them and I believe in their mission, and that's when I landed with Rubicon MD. Both of our co-founders are very mission focused and have personal stories that led them to develop their healthcare company, Rubicon MD. To give you some context, what we do, our mission is to democratize medical expertise. And all that means is, we believe in improving access by moving information instead of moving people. So what we do is we have an e-consult service where we help connect primary care clinicians to specialists. And we work a lot within the safety net. So Medicaid populations, uninsured, so on and so forth. So through another contact, again, that led me to Jacqueline and Alaska, and very well aware now of all the access challenges in Alaska. So me personally, the way that I can contribute is just bringing my team and our expertise to the table. I work with a ton of collaborative people who are very mission driven. And what I'm asking for is, just like Andrea mentioned earlier, is any introductions to other healthcare stakeholders in Alaska who are bent on improving access through technology solutions. Again, we innovate around primary care. So anywhere where there are, primary care groups, clinics, and even now I learned that ANTHC has similar technologies. We're also looking for technology partners. How can we bring our specialists and other ways that we're innovating? Another thing that we're doing is we're going deeper within our specialists. So now instead of just primary care to specialty expertise, we're expanding so that we can bring specialist to patient expertise. And we're starting with behavioral health. So again, we're just looking for primary care groups or other partners who like to partner with us to get access to our specialists.
Awesome. Thank you, Arcadio. So next, we're going to go with Rebecca, Elizabeth, Meg, and Erin Baca. And then we'll be almost done, but that's the order. Thank you.
Hello, I'm Rebecca Van Wyck. I'm a research associate at the Institute for Circumpolar Health Studies, which is within the Division of Population Health Sciences within the College of Health at UAA. I am here because within the division and at ICHS, we're very interested in addressing health issues in Alaska, and have expertise in testing interventions across Alaska. And I'll leave that as what we have to offer. I'm very interested in seeing how the university could be responsive to community issues and support Health TIE in its development as well.
Good afternoon. My name is Elizabeth King. I am the Director for Behavioral Health, Workforce, and Health Information Technology at the Alaska State Hospital and Nursing Home Association. And I have heard a lot about Health TIE. This is my first time attending a meeting. I'm really interested in innovation and maybe learning more about kind of the innovative ideas that are coming through for healthcare. A personal passion of mine is social determinants of health. I know Carolyn, Dr. Brown, as you were talking about, that is something that I'm really interested in figuring out, how to really leverage the information that's coming out about all of the different ways that social determinants affect health, and particularly around what innovations can be used to streamline that and really support people in new and better ways. And what do I bring to the table? I have the unique position of being affiliated with the hospital association. So I have a lot of members who are hospitals and nursing homes that could potentially benefit from getting the information about these ideas. That's where I think I am. Unfortunately, I actually have to go in about 3 minutes, but I want to thank you for having me here today, and I hope to be able to make the next meeting.
Thank you. And I will interject because you have to leave. Thanks for joining. And I hope it's okay, but somebody from Health TIE will reach out to you. And it'll probably be Jacqueline. And then thanks for sticking through this, even though it's your first time. I know it's not our traditional call. You don't get the heavy dose of innovation, but I guarantee if you come back next time, you will. So thanks for joining us, and have a good day.
Thanks. I'm looking forward to it.
Great. Thank you, Elizabeth, for sharing, everyone. Hello, my name is Meg Waite, and I am from Boise, Idaho. I'm a non-traditional first-year student at the University of Fairbanks in the Biological Sciences program at UAF. And I first learned about Health TIE, similar with Solomon, through a COVID health event. And I am in the Students to Startups program through Alaska Center for Innovation, Commercialization, and Entrepreneurship this summer. I'm also helping co-found Integrative Mushroom Solutions. It's a mushroom-based business that's focused on collaborating with other researchers, scientists, different industries to help bring sustainable alternatives to their industries with the use of mushrooms. And this is also through a nutraceutical product line that we are currently exploring. My background is mostly in the outdoor industry, and I have traveled and worked in southern Chile, Pacific Northwest, and Colorado in my time outside of my education. My interest in Health TIE lies in my background of complex PTSD, and unfortunately I have had suicidal ideation since the age of 9. And I love nature, and I found it very healing, and the issues that I've dealt with both mentally and physically as an athlete, I would like to see, and I should note that I have used Wi-Fi only until moving to Alaska in 2018. And so with that, I would love to help collaborate. I have a small network in Fairbanks, specifically in some software development, close acquaintances and friends in occupational therapy and physical therapy that work with children. And so I would love to utilize this. Also, I'm an artist. I would love to utilize Health TIE as a platform to connect more members of Fairbanks in this mental health challenge that's been proposed. And I'd like to see more people know how to help vulnerable members of the community, whether that's elderly, whether that's people with disabilities, either mental health issues or physical disabilities that could really utilize technology here in Alaska. So thank you.
All right, so that's not easy to follow, but hi Meg, nice to meet you. My name is Erin Baca. I'll be super brief. I know we're running out of time and we have also other interesting people on the call. So I work at 49th State Angel Fund, which is a venture capital fund that's run at the municipality at City Hall. So we have just launched a new co-investment fund, which is almost a near automatic match of private capital investment into businesses of between $10,000 and $25,000. So if you know of any businesses looking for funding, let me know. And half of that fund is dedicated to the Building Equity Fund, which is for Black, Indigenous, or people of color-owned businesses. I am interested in health tie because I think I said this at one of the first meetings. I'm a human, and I will get into the nooks and crannies of my own and my husband and my family's journey. But I mean, I will say I grew up on public assistance for the first half of my life, and that is not easy. From every aspect of the way you're treated when you're poor and the way by doctors and other professionals to the types of access that you have. So I'm very fortunate to have really great healthcare right now. And I hope that I would love to be part of or cheerlead Jacqueline, Jake, or anyone else to figure out how we can get the type of access that I currently enjoy through my husband's work insurance. So that's it. Thanks. And I guess just health tie, I just generally support you guys, and I love anything Jacqueline does, and I'm always here if you need anything from funding to connections to resources. I send everybody your way that I think might fit, and will continue to do so because I think this is wonderful.
Thank you, Erin. I just want to say, I know we are getting close to our normal end time, but we're not going to do a hard cutoff at 1:30. This is really valuable to us. Jacqueline and I think, are both learning a ton. And we may even have time for a couple of questions afterwards. I noticed in chat that Annette said that she needs to leave. So I want to give you a chance, Annette, before you go, if you want to say hi, but you don't have to. And then after Annette, we'll go on to Steve, Tarek, Kai, and Bunti.
Hi there, sure. Just in 1 minute, my name is Annette, and I was a passenger in a rollover car accident with a reckless driver years ago, and have sustained a traumatic brain injury and other internal injuries. So now I am the Alaska partner for Unmasking Brain Injury, which is a global brain injury awareness project where people with any kind of traumatic or acquired brain injury can make a mask with an explanation of their art to share what it feels like to live with a brain injury. The website is unmaskingbraininjury.org. I also provide annual education, which I started when our only traumatic brain injury specialist physician and a physical therapist with decades of neuro experience were leaving the state at the same time and going to leave a void. And so a group of volunteers and I just all got together and planned education with credits in 5 different professional fields. And since then, that's been increased to 9 or 10 per year. So I usually am the only person in a space like this that is completely volunteer-based and not affiliated with a university. I'm also usually the youngest person, so I'm glad to see that's not the case right now, which is awesome. And so I am looking forward to getting to learn a little bit more. I also do an annual disability awareness art show in my area. And so if anybody's interested in participating in that or networking around that, my only question before I go here, since I have another meeting right now, is this open to everyone, or is it generally folks who tend to be affiliated with organizations? I've been told I cannot participate in events that I have helped to coordinate before because I am a patient, although the term patient was not defined at the time. And so I just want to verify, because I tend to have more community organizing related perspectives and kind of think outside of the box kinds of perspectives, since I'm not held back by grants and stuff like that. I'd just like to know that answer real quick before I jump in, so that I can know the lens through which to participate.
Thanks, Annette. Well, you're in the right place. We really want people, you know, the one unifying interest here is that we want to fix healthcare in Alaska, nationally, in the world. And we all have our own motivations, but you're absolutely in the right place. And we want as many viewpoints and ideas brought to the table as possible. So you definitely are welcome and should come back and bring your friends.
Awesome. Thank you so much. Just double checking. And thank you. Gotta go. Bye.
Hey, Jake, it's Kai. Was I next?
I have another meeting. Thank you all. I look forward to chatting soon.
Yeah, Kai, then Steve, then Tariq or Tarek, and then Bunti. That'll be our last.
Cool, thanks. Hi, everyone. Kai Holland, I'm here in Anchorage. And I guess briefly, I've been involved in the startup ecosystem, some of the education programs, and the venture capital funding world for the past few years. So, you know, looking ahead, I have a lot of connections and experience in those areas. I am taking a bit of a sabbatical right now and trying to discern what I will be doing next. So in terms of what's ahead, I'm looking forward to this group continuing its work, and I'm particularly interested in potentially shifting my focus into healthcare and potentially seeing how I can help with open innovation strategies and investment funds to stimulate challenges and seed funding for medical related solutions and making sure that as our world goes ahead, we find a new normal that doesn't require us to go through what we've been doing in the last 6 months. Thanks all.
So I guess it's me now. And people are throwing thumbs up, so I guess you can hear me and everything. Okay, so I'm Steve Myrop. I'm the Chief Financial Officer of Three Bears, Alaska. My interest in Health TIE is, well, let me back up for a second. So sort of unintentionally in my life, I guess I've been attracted to big, difficult, gnarly problems and solving those problems. And so Nigel Sharp was aware of, you know, kind of that. And also that was early in my life. It just sort of happened to me. Now, more intentionally in this stage of my life, I'm taking those kinds of problems on. So Nigel was aware of that. And so I got invited to the Health TIE kickoff, and I participated in that. And then now my interest in Health TIE is really in, like Jake said, you know, fixing healthcare, you know, ultimately globally. And so what I do is, you know, I'm Chief Financial Officer of Three Bears. That takes up most of my time, but I have ties and connections and a Rolodex and so on. So I just kind of hang around the edges. I've been a participant, or at least, you know, on, you know, observing all the meetings, and where I can, I make an introduction, etc., and just try, and I'm just hanging out looking for ways that I can help. So that's that.
Thank you, Steve.
Thank you. And thank you everyone for, you know, working on this.
Is it my time?
Yes.
Okay, my name is Tarek Thomas. This is my first Health TIE. I learned about this organization from Kilda Parstats. She used to be my supervisor at Senior and Disability Services, where I helped in design their platform to do all their assessments and observations from a distance, along with helping to improve their video teleconferencing capability and helping them to get a BAA signed with Zoom. I have over 10 years of experience in healthcare and telemedicine, telehealth, because I used to work for Alaska Federal Healthcare Partnership and Afghan. The reason why I'm interested in this group is because I recently just started my own consulting business, so that I can actually talk to individuals like this, that's on this call, to see if my ability to can help them advance their potential in talking and treating patients from a distance, because I specialize in telemedicine, telehealth since going to school at APU and graduating from Regis University, that's in Colorado. And this is the first time I'm actually telling people about my business. So thank you.
Thank you. Last but not least, Bunti, and I have to say it before she does, Bunti is my mom, but hopefully she actually is listening and that she can introduce herself. And then after that, I think we will wrap it up, but I appreciate everybody coming here, and feel free to sign up for our mailing list. We will try to do this kind of call, I won't say monthly or even quarterly, but a few times a year, so that we can catch up and make sure that we're serving everybody's needs.
Okay, I'm unmuting myself. As you can probably see by looking at us, if I had a goatee and dark glasses, I would look just like Jake, or he like me. So I am his mom. I am also currently the consumer representative on the state medical board. And I have promised to attend these calls for a while and haven't gotten to them, but today I could take lunch off. I have an adult son who experiences traumatic brain injury. He was injured in an accident at 11 years old. He became permanently disabled by that, so I'm his primary caretaker. I am also an individual who has an autoimmune disorder, and I'm still working full-time at 66 years old to keep myself covered with insurance, even though I'm a full-time caretaker. And I've worked as a care coordinator in the state of Alaska and the state of California, and beat my head against the wall trying to get people the coverage they need for many, many years. So I feel very strongly about affordable, accessible, and effective health care for every man, woman, and child. I think that the more of us that get together at a grassroots level and make those changes, that probably will happen. And I also, and I've talked to Jake a little bit about that, I hope to make sure that, as in Alaska, our medical review boards meet, that everybody is noticed on them so people get to come forward and give an opinion, because it does make a difference, at least under the current structure of the medical review board. It's a really good thing. Anyway, and I'll hush, but I'm glad to finally be here.
Thank you. Now, before we sign off, I'm gonna hand it over to Jacqueline to see if she's got any last minute stuff. I did want to point out one resource that was pointed out during the meeting was the unmaskingbraininjury.org. It looks like a really cool site. I put the link in chat if everybody wants to check that out. And then Jacqueline, anything else before we close out?
Just thank you everyone for coming and for sharing who you are and why you're here. Jake and I had aspirations for asking you to wave a magic wand and change one thing in healthcare, and we haven't gotten to that. Obviously, we always have high aspirations and not enough time. So what I'd really like to be able to do is connect people. We wanted to create a community. So if you have heard someone here that you'd like to get to know better, I just encourage you to email me and I can make those email introductions. Otherwise, thank you very much for allowing us this time to get to know each of you better. And Jake, it was a pure pleasure to meet your mom. That she sounds amazing, and it was nice to see her, and very nice to meet all of you and see all of you again. So thank you very much for coming. The next presentation will be from Alice Brouhard. And so we appreciate her being here, and we look forward to seeing you again, Alice. So thank you, everyone, and we'll see you soon.
Thank you, Jacqueline.
Goodbye now.
Bye-bye.
Goodbye, everyone.